How do cultures define addiction? Imagine trying to understand what addiction really is without a single universal answer. Different societies see it through their own lenses, shaped by their beliefs, traditions, and history. That's what makes this topic so fascinating. Cultures have unique ways of understanding and labeling substance use and dependence. For some, addiction is seen as a moral failing or weakness. For others, it's considered a health issue or a spiritual challenge. These views influence how people seek help and how communities respond to those struggling. In many cultures, using substances like alcohol or plants such as peyote is part of spiritual or ceremonial practices. These substances are not viewed as addictive but as sacred tools for connection or healing. When used in this way, their use is controlled and respected. But if the same substances are used outside these contexts, they might be seen as problematic or addictive. This shows how cultural context shapes what is acceptable and what is not. Social norms play a big role. In some societies, drinking alcohol is a normal part of social gatherings and family life. It's seen as a way to bond and celebrate. In others, even small amounts of alcohol might be taboo, and any use could be stigmatized. These norms influence whether addiction is seen as a personal issue or a societal problem. Stigma and shame are also important. In some cultures, admitting to addiction can bring shame to the family, making it harder to seek help. For example, in many Asian communities, addiction is viewed as a source of family disgrace. On the other hand, cultures that emphasize family support, like many Hispanic or Latino communities, often encourage collective efforts to help loved ones recover. History and social change also shape these views. Colonization and migration have disrupted traditional practices, sometimes leading to increased substance misuse. Indigenous groups, for example, once used certain plants in rituals, but colonization often replaced these with problematic drinking patterns. This history influences how addiction is understood today. Cultural identity and how much someone adapts to new ways of life matter too. People who stay connected to their native traditions tend to have different experiences with addiction than those who feel disconnected or pressured to assimilate. Maintaining cultural roots can be protective, while cultural loss can increase vulnerability. Finally, how treatment is approached depends on cultural beliefs. Some communities favor family and community involvement, spiritual healing, or culturally specific programs. When treatment respects these traditions, people are more likely to engage and succeed. Understanding how different cultures see addiction helps us create better support systems. It reminds us that addiction is not just about the substance but also about the social and cultural environment surrounding it. Recognizing these differences allows for more respectful and effective care for everyone affected by substance use issues.